Your Excellencies, distinguished delegates and participants, colleagues, ladies and gentlemen, Sawadee. In 2019, WHO announced a new 5-year global strategic plan with a focus on the so-called triple billion targets, ensuring 1 billion more people benefit from access to universal health coverage, 1 billion more people are protected from health emergencies, and 1 billion more people enjoy better health and well-being. In the same announcement, the WHO Director General also highlighted some important areas of focus. First, he announced a list of the 10 most important threats to global public health, a list that included the threat of antimicrobial resistance. He also emphasized that reaching these ambitious goals would require a variety of different approaches, and that this would require working with a very broad coalition of partners. Along the same lines, also at regional level, has the threat of AMR been one of the 8 flagship priorities since 2014. Distinguished participants, the development of antibiotics, antivirals, and antimalarials are some of modern medicine's greatest successes. But as you know, time with these drugs is running out. Antimicrobial resistance threatens to send us back to a time when we were unable to easily treat infections such as pneumonia and TB. The inability to prevent infections could also seriously compromise surgery and treatments such as chemotherapy that can leave us vulnerable to infections. Drug resistance is driven by the overuse of antimicrobials in people, but also in animals, especially those used for food production. Some of these practices can also lead to contamination of the environment. World Antibiotic Awareness Week aims to encourage best practices among members of the general public, healthcare providers, and policymakers, with the aim of avoiding further emergence and spread of drug-resistant infections. The theme for World Antibiotic Awareness Week 2021 is Spread Awareness, Stop Resistance, which is clearly a call for action for all of us. It's for all these reasons that I've mentioned that WHO is working together with FAO, OIE, UNEP, and other international partners, including US CDC and USAID, to take forward this important work through a One Health approach. But of course, we are really here to support you, all of you, the key AMR stakeholders in Thailand. It's clear to me, looking at the list of agencies supporting all the activities this week and joining this meeting today, that the intersectoral antimicrobial resistance collaboration in Thailand is very broad and that it reaches to all levels of community and society. We would like to commend you for all the good work you're doing, and we look forward to supporting you in the coming months and years as you move forward with the development and then the implementation of Thailand's new National Strategic Plan for Antimicrobial Resistance. Khop kun kap, Sawadee kap.